So in terms of the agenda, so we're going to be focusing on introductions for the first 10 minutes, and then around 25 minutes thinking about our different journeys into the doctor in clinical psychology training, and then also leaving sufficient time for some Q&A. So just to make you all aware that we will stop the recording at Q&A. And like I said, the video will be made available on YouTube as soon as possible. So for the Q&A, we will only be answering questions provided on Slido. So before, well, as you signed up or registered for the event, you should have received a link for Slido. So please do submit your questions there. And in terms of the questions that we will be answering, we will only answer questions in relation to our different journeys towards the DClinPsy and not questions on applications or interview, because we will have specific webinars focusing on those different topics. And at the end of the session, we'll be most appreciative if you could complete a feedback form, because we're always wanting to improve the qualities of our webinars. So we would really appreciate it if you could just complete it, and it only takes a couple of minutes. Okay. So handing it over to Marissa.
So we thought it might be helpful before we start to talk about our journey to actually address some of the common misconceptions we might have. And of course, there might be further questions you have, which of course you can add on to Slido. But a really common one that comes to mind is, oh, I need that AP role before I apply. And often it is seen as sort of the gold standard kind of route into the doctorate training course for psychology. But that's not to say it's the only route, and hope we can sort of try to clarify that today a little bit. But even just from what the Clearinghouse website says, it says although that is a common route, it's not to say other routes don't apply, and they can also give sort of similar really helpful clinical experience. So some examples might be sort of working in social services, being a mental health support worker or a healthcare assistant, even a nursing assistant. So what might be helpful to consider is think about how those experiences more broadly relate to psychology. So does it give you, for example, a sense of what a clinical psychologist might do? It might give you a sense of maybe what sort of clients a clinical psychologist might work with, but also the organisational context, so what teams are there and what sort of other kind of liaison work might be involved with that. So I guess it's just to say that there isn't one set route, and it might be helpful to kind of look at those options on the Clearinghouse website as well. Another really common misconception is I need loads of experience, or years and years of clinical and research experience. And I guess just to add, this can vary from course to course. I think on the Clearinghouse website, some courses, the minimum requirement is up to 12 months, either clinical or research experience. But it's more so about what you make of that. So it's more so the importance is the quality of the experience rather than the quantity. So for example, what have you learned from that? How has that helped you to develop your skills? How has that helped you to sort of develop your sort of personal and professional values? So it's thinking more about the quality of that experience as opposed to needing years and years of experience relating to that. And what we'll touch on as well soon is also helpful to hold in mind the competencies of a psychologist. So again, some of these roles will link to a lot of these will sort of link to all these similar roles. So just holding that in mind. Another sort of common misconception is relating to sort of publication. So no sort of on the application form, that question asking about publications and disseminations can feel quite a daunting question. And I remember when I was applying, I was thinking, oh gosh, I don't have a publication. Am I ready to apply? But actually, that's not the case. You don't need a publication. There are various ways of sort of gaining research experience, and everyone's experience will be different. So it might be, for example, a project involving data collection or data analysis. So most sort of undergraduate sort of psychology roles psychology courses will have a sort of research component, and usually that's sufficient if you can sort of draw upon that and reflect on that. It might be that you've sort of done a project in service, or something like a service evaluation project to see maybe how sort of a psychological group has gone, or an audit of kind of what sort of clients we're seeing or maybe missing. So it's just to kind of hold in mind that you don't need a publication. Research can look different for different people in terms of their experiences. And that also links to the next point of you need a PhD. So I think there again can be this kind of idea of, oh, do I need a PhD because it's so competitive? do I need sort of loads of qualifications? But again, that's not the case. It's more about trying to seek opportunities and see, again, if it relates to sort of clinically relevant research, how you can try and get that in your current roles that you're doing. And I guess the final sort of misconception people might have is I need a reference from a clinical psychologist. So although this can be quite helpful, just because clinical psychologists do know sort of that process best and what their kind of role involves, that doesn't always have to be the case. So I know for myself, I didn't have a reference from a clinical psychologist, and this again was quite a big worry in my mind at the time. So it can be someone from an equivalent position who supervised you and kind of knows your skill set best and how best to sort of showcase that for the application. So yeah, don't worry if you don't have a clinical psychologist reference, or if that's something that was on your mind that's holding you back from applying. Yeah, hand over to Take now to talk a bit more about sort of what are the core competencies of a clinical psychologist.
Hi everyone. So I'll be sharing a little bit more about the core competencies of a clinical psychologist, and I guess we thought it would be helpful to talk a little bit about this to have a kind of better understanding about what kind of clinical psychologist does, what kind of underpins the role of it. So this is actually taken from the BPS website, so you guys can find it there as well. So I wouldn't go too much in detail about what kind of entails each part of it, but essentially it breaks down to assessment, intervention, formulation, communication, supervision, audit and research, evaluation, and we added in leadership as a core competency within clinical psychology. And I guess looking a little bit at the diagram, the main kind of aspect that underpins, if you look at the inner circle, it's audit and research. And I think a big part of clinical psychologists, what we do is research and evaluation, because that kind of underpins what kind of assessments, how we do assessments, our formulation, what kind of psychological therapies we provide, or in your cognitive assessments, what we kind of choose. It's all really underpinned by research and what is evidence-based. So I think this is a very kind of general overview, but yeah, just kind of giving a little bit more about the background of the core competencies. And it would be helpful, I guess, to look, if you guys are interested, to look a little bit more into this, because it would be helpful, I guess, thinking a little bit about what kind of experiences you'd like to gain along the way of before getting on to training, because I guess these are the things that reviewers would look at when reviewing applications. So we will, just aware of time as well, so we will move on to kind of sharing a little bit more about our own experiences getting onto training, so what we kind of did during undergraduate all the way up to getting onto the doctorate. So I'll pass the time now on to Jason and Marissa.
Actually, it's Alistar first.
I think I'm first.
Sorry. Yes.
No, good. We've swapped the order out, so it's all good. So hi again. I'm Alistar. I've had a slightly kind of bending road into kind of the clinical psychology training. So I did my undergraduate degree at Cardiff University, and it was in actually journalism and cultural studies. And during that time, I was very interested in psychology, but didn't have a huge amount of awareness about kind of routes into psychology, especially not clinical psychology or the varying kind of clinical degrees, or careers that are available. And throughout this process, I was kind of doing a lot of extra reading about psychology and kind of related subjects, and I kind of came across conversion degrees. So when I kind of discovered these, I was like, this is excellent. This is a chance to kind of change my degree into what I kind of wish I'd studied in the first place. So I did the psychology MSc conversion course, which I actually found really intense. Is cramming that much subject matter into kind of a 1-year course, and kind of working on the side part-time and doing some volunteering as well. That was actually a really intense kind of year and experience. And trying to kind of manage that kind of extracurricular life outside of that, so social life, societies, things like that. So once I completed the MSc, I think probably something that a lot of people can kind of resonate with or sympathise with is I really struggled to find a assistant psychologist post. So I spent a kind of 6 months working as a residential support worker with individuals with a range of psychiatric diagnoses and kind of developmental disorders and things like that. And then during that time, I was just applying for AP roles and various different jobs. And I eventually kind of got a research assistant position. And that was kind of a fork for me, a fork in the road where I was applying to both assistant psychology jobs and research assistant jobs. And I got a research assistant job. So that was kind of me going down the research path at that point. And I kind of didn't look too much kind of initially back at the potential lost kind of DClin route. So I worked in that job for kind of 2.5 years, and it was kind of looking at genetic studies and the genetics of psychiatric kind of conditions over time in different populations. That was a really great role, and that kind of gave me a lot of research experience and presenting at conferences, and we did some outreach activities. And then just to put it into context, during this time I was applying for the DClin kind of every year, kind of going through that process, and didn't get in. So yeah, so eventually after a few tries, I was offered a PhD in London. So I moved to UCL to do a PhD in environmental psychology, and this was kind of looking at kind of how physical environment of children with neurodevelopmental disorders influences aggression outcomes and other kind of neurodevelopmental trajectories. And again, that taught me a lot about various research practices and really kind of developed those research skills. Alongside that, I was working kind of part-time developing a mental health kind of digital mental health app. So I was kind of getting an insight into elements of kind of clinical psychology practice, kind of working with different clinical populations and trying to build up that clinical expertise. Because I was kind of the route through the research and PhD really kind of instilled in me my desire to kind of try again at the DClin and kind of go down that clinical route. And then, yeah, I got on, had an interview this year and got on. And I've been kind of the last 2 months on the DClin at UCL. So I don't know how we are for time, but I just kind of noted some key points for me anyway, that kind of I've experienced throughout my journey. I applied 4 times, and this was going to be my last try. So luckily I got on, but I was kind of in my head had kind of situated it as, yeah, I'll try one last time, and if not, I'm going to continue down a career of research and use my PhD and progress that way. So don't give up, you know, is one takeaway. Another element for me and other people I've kind of talked to throughout the DClin journey is I come from kind of a lower socioeconomic kind of working class background, and there's a little bit of expectation around terminology and language and how to kind of you know, communicate a professionalism, especially in interviews and in face-to-face. And I would say that's just something I've been aware of and kind of I've met people as well kind of on the course who sometimes there's that expectation of kind of being performative in how you come across sometimes, and actually it's okay to use different language, and if you come from different kind of cultural or social backgrounds, that's fine, and that's part of who you are. My motivations have just changed over time. Over the last 10 years before I got on, my motivations have gone from research to clinical to a blend of the two. So just to say that your motivations will probably have changed and will change. And just for both training and development, you know, you'll learn all the clinical skills you need and all the research skills you need. But I think resilience, you know, it's tough, you know. No matter where you go, what course you get on, it's kind of physically and emotionally draining, and sometimes it can feel like, oh, you know, getting onto the course is the final destination, but actually having that awareness that it's just the start. So yeah, that's everything from me.
Thank you, Alistar. So we're going to hand it to Marissa next.
Thanks, Alistar, for that. So my journey is a little bit different as well. I didn't do sort of a psychology undergraduate. I did cognitive and clinical neuroscience at Westminster University, and partly because I actually hadn't heard of the doctorate psychology course at that point, but by luck it was actually accredited by the BPS, so I didn't have to do a conversion course. So this was really kind of helpful again to kind of build some insight into sort of psychology and what that might look like, but it still didn't sort of touch on sort of the therapeutic aspect, which I was really interested in, starting to build interest in sort of third year. So I sort of continued to do a master's in psychiatric research, and this kind of helped me to kind of gain more sort of clinically relevant research experience. So working with people who have psychosis and sort of developing skills in sort of assessment. So I was able to do sort of an honorary research assistant role as part of my master's, and that then kind of led hand in hand with my master's project, which is quite nice. So I had the opportunity to sort of disseminate and present that poster presentation. So again, another opportunity of just holding in mind that dissemination can be different for everyone, and that's kind of what I reflected on in the process of how I made most of my research experience through that. I was also sort of able to develop some leadership roles. So I was sort of the MSc course rep, and it was really helpful to sort of liaise with sort of different members of the course and be able to sort of collectively feedback what the cohort sort of views were of the course. And by this point, I was sort of developing some sort of voluntary experiences as a ward volunteer. So it helped me to sort of build on some of those sort of core therapeutic skills that are really valuable now. So sort of active listening, empathy, compassion, and just thinking about how people sort of how psychology sort of sits in sort of the medical model as well. So that really helps to bring about some awareness of that, and again further motivate me to sort of look into sort of clinical psychology. So whilst I had that research experience, I was aware at this point that I didn't have any clinical experience, and I didn't actually apply for the doctorate until I felt ready. So I actually waited a few years, and I only applied once. So I thought, before I apply, let me get some clinical research experience, and I applied for the low intensity cognitive behavioural intervention course. So this is, in other words, sort of PWP training, and this was really valuable experience for sort of gaining those core competencies and sort of think about formulation. So using sort of low intensity cognitive behavioural therapy model, think about sort of, I was reflecting, you know, how that made me think about diversity and embracing difference and how I can incorporate that in my clinical work. So it really helped me to think about, you know, what I'm bringing into the profession as someone who's from a South Asian background and a working class background, and what that meant for me when I'm working with clients from different backgrounds as well. So that was really valuable for me. And I think a key thing that kind of taught me about this whole process is about sort of seeking opportunities. I think that was quite a clinically intensive role where we were sort of delivering one-to-one sort of sessions, but sort of being able to sort of do extra things on the side. So sort of a young person's lead, and also a lead for sort of racially minoritized groups, thinking about how we can increase access to the service. So it really gave me the opportunity to be quite creative and go into schools, deliver talks, sort of develop workshops and working with the local communities. And that really resonated with my values. I think one thing just to hold in mind is, like, think about your personal values as well and how you can bring that into work. And often you'd be surprised how you can then sort of, blend the two and become sort of develop your professional identity through that way as well. So that was really valuable experience for me. Alongside this, I was sort of doing a bank mental health support worker role. So again, it was really helpful to hold in mind how sort of we can work systemically with sort of families and different teams and advocate for our clients. So these were the clients who had neurodevelopmental conditions and also mental health conditions. And I also had sort of an honorary AP role as well, but unfortunately was cut short due to COVID. So I wasn't able to sort of get the most experience out of that. And yeah, kind of like Taco was saying, just holding in mind those competencies. So just thinking about, you know, the opportunities where you can do teaching to other members of teams that you work with, or supervision or mentoring or some sort of training. So I guess it's just thinking about how you can make most of the experiences that you have. And I think on reflection, these were all really helpful for me to sort of think about how I could sort of then bring that into my application. So I then felt ready after doing my PWP role to apply. I was lucky to get on my first time, but again, like I said, I waited quite a few years to feel ready, just because I imagine some of us do trial runs and we can get quite invested in that process. And I felt it was helpful for me to just kind of think about what those core competencies were, but also what was that personal specification for a trainee psychologist, and think about how I could meet those areas. But that was mainly my journey. And I think, just a piece of advice is, like Alice was saying, you know, that resilience is really key. It can feel like quite a long journey, or a really stressful one, but keep going. I think everyone has value to bring, so embrace your sort of differences and your reflections, and sort of hold those in mind as you kind of gain new experiences going forward. So I'll hand it over to Jason, he's got quite a similar route, but a bit different as well. So
Thank you, Marissa. Can you hear me? Okay. So in terms of my experience, it's like Marissa said, we're almost like a carbon copy. We're quite similar to one another. But for my, I guess, academics, I did my undergraduate at Bristol University. So I did just a psychology, and it was BPS accredited. But I think my reflection at that time was during my teaching, I didn't learn anything about clinical psychology at all. So I didn't understand what clinical psychology training would look like. I think there were occasional talks or events, and I think nowadays there's a ClinSoc society. So I'm aware that a lot of the audience, so this webinar is really targeted at early career aspiring psychologists. So a lot of you might be an undergraduate or doing a conversion, master's. So just wanted to reassure you that during my undergraduate, I had no idea that I wanted to go into clinical psychology, because I think the exciting thing about having a psychology degree is you can go into so many different jobs. But during my undergraduate, I didn't gain any clinical experience at all. But what I really want to emphasize is your other jobs also are relevant. So for example, I worked part-time as a retail assistant, and for me that really helped me with my future career, because it taught me how to time manage working under pressure, so kind of balancing your academics but also working. So that's a real skill that we need as a clinical psychologist, because the doctorate is a 3-year course and you have to do research but also working clinically on placements. So just wanted to emphasize that all experience is really important. I guess one tip here is that other colleagues of mine during undergraduate, they actually gained part-time jobs as support worker. So actually throughout the undergraduate, they accumulated a lot of helpful experiences. So if you are currently in first year, second year, I would really recommend just looking at support worker jobs, just to see if mental health is the right field for you. But in terms of my in terms of research, I also did a master's degree in developmental psychology at King's. So overall, I had 2 research projects under my belt for my academia. But really thinking about my pre-training work experience, I also trained as a P2P, but before then, I worked as a healthcare assistant for 10 months part-time. So I just wanted to emphasize that a lot of these work experiences were done during my master's year, because I think during my master's, that's when I started noticing, actually, I'm really interested in working in mental health, specifically in clinical psychology. So it's really doable. It's not necessary that you have to gain all the experience during your undergrad. So yeah, so I worked 10 months part-time as an HCA in an eating disorder ward, and then subsequently in an addictions specialist unit. And then after that point, it was COVID at the time. So I was quite fortunate that I secured an assistant psychologist post, but this was voluntary on top of my healthcare assistant job. And at that time I was working in a third sector charity called Helen Bamber Foundation, which really focused on supporting survivors of extreme human cruelty. And I guess another point is you don't necessarily have to look at NHS experiences. You could look broader at third sector charity experience as well. They're also relevant. And during that time, I also was working as a research assistant. So it was 2 separate posts, and in total, it gave me 6 months full-time experience. And then after COVID, I trained as a P2P. Before training, it was around 1.5 years at the time of the application. So I'm not going to go through the other bits because it's quite similar to what Marissa said. But what I wanted to focus on was actually just my own reflections. So before applying to training, I was very lucky to be part of something called the Valued Voices Mentoring Scheme. So this is a scheme that's run by Dr. Shah, and it's run by UCL essentially. And the scheme is offers racially and ethnically minoritized individuals the opportunity to be paired with 2 clinical psychologists. And that really gave me an insight on what it was like to be a clinical psychologist in different settings, but also helped me think about which courses aligned with my own values and experiences. I would really encourage you to look at Clearinghouse because all different courses have different orientation and different specialities. So really take a look at that. But also the benefit of having 2 clinical psychologists is that a lot of my experience pre-training, I didn't have a clinical psychologist I was working with. So my reference was actually from a CBT therapist. So just to highlight that you don't need a clinical psychologist as a referee, but it really helped me identify my strengths and areas for development. And at that time, I noticed that I didn't have as much research experience, which comes on to my next point, is to find opportunities in whatever role that you're doing at the moment. So for example, when I was training as a P2P, there really wasn't research research opportunities, very unlike assistant psychologist posts where you might do audits, etc., etc. But for me, what I did was I conceptualized a research idea based on my own experiences of accessing therapy, which really resembles the research process and the research cycle. So identifying a gap in research, developing that research, and then implementing it. And what was helpful was actually just socializing and connecting with people on LinkedIn. And eventually I found a research team by myself which had similar interests, and we wrote a paper. I guess another reflection similar to what Alistar and Marissa were saying is that I just really want to normalize unsuccessful job applications. So it took me 20 applications before I guess training to secure a role in a mental health job. So I applied to 20 different assistant psychologist posts, but was all unfortunately rejected until I got the trainee P2P post. And I guess for me, at that time, was the lack of research meant that I could just apply for AP Pros fresh after my undergraduate. So really make sure that you read the job descriptions and see if you've got these skills, and if not, then what can you do to build on that on your clinical portfolio. So I guess what will be really helpful is to apply for healthcare assistant or support worker roles, which are really valuable, and you also get to do a lot of important therapeutic work. What I'm going to do is I'm going to hand on to Take for the final reflections journey.
Hi everyone again. So yeah, I'll be sharing about my journey, and I guess before I kind of go into that, I just really want to acknowledge and really echo what the others have been saying in terms of rejections. I think what you see that we have presented like on the slide right now are the successes in that sense, that we have gone through a lot of rounds of applications, applying to different things, and a lot of rejections. So I think it can be overwhelming when you attend these talks and webinars and you see people getting all the experiences, and how do they do that. And I just want to acknowledge that, yeah, I think it is very common to receive a lot of rejections, and I think it definitely isn't nice to receive a rejection, but really, like what the others were saying, to not give up, and really kind of branch out and see what kind of opportunities there are. I didn't count how many applications I did, but definitely so many, since undergraduate, and definitely more than 50% are rejections. Yeah, I think I've been rejected too many times to actually count how many times I've been rejected. But yeah, I'll start with kind of undergraduate kind of experiences. I think quite similar to the others. I didn't think I would go on to do clinical psychology when I first started my undergraduate. I was in quite a privileged position in my undergraduate course, which I did do in the UK. We were kind of exposed to kind of different routes after psychology. So there were educational psychology, clinical psychology, research, and I know people who actually then went on to do banking, consulting, and all that kind of stuff. So I think during my undergraduate, I really did try to kind of see what I was interested in. So I think extracurricular stuff, I didn't really specify what I did, but it was mainly non-psychology related things. But I did think that it was really helpful in building skills such as communication, leadership skills. So I think really trying to see what you are interested in is a very helpful kind of process to kind of identify if, I think, first of all, clinical psychology is really what you want to do. but yeah, within my undergraduate, alongside kind of in school or after school, I did do internships, and during kind of holidays as well, summer holidays, I did find kind of RA experiences. And I think one of the things that I was initially quite worried about is, you know, I recognize that during, you know, Christmas break or summer break, it's not long. And I always wondered, you know, what can I actually get out of that? You know, sometimes it's just a few weeks to a few months, right? But I guess I was quite pleasantly surprised in terms of what I actually learned. So throughout the kind of research experiences, you know, really thinking about the competencies, let's say within research, you know, on one job, I just focused on how it is like to do a literature review, you know, searching terms and using databases. And, you know, that was it. That was the end of my kind of first RA experience. And then the second time I then focused on, okay, data collection, you know, and what the processes within that is. So, you know, within my kind of undergraduate kind of experience, apart from my own undergraduate kind of research, I've never seen a research project through from the start to the finish, because that was just not kind of feasible in that sense. But I think that still kind of was really helpful in helping me learn kind of the processes within research. So yeah, I think just highlighting in terms of that, I think it is kind of reflecting on what you learn within each experiences. It doesn't necessarily have to be, you know, the perfect experience. You have to have done whatever things on it, or however long you have to do. Yeah, so I think just wanting to highlight and reflect on that. I think pre-training as well, I kind of was only in one role, which I think this is also something that is commonly asked in terms of, do you have to try different do different posts, do different roles to get different experiences. I think back to what Marissa was saying initially is in terms of also the quality of the experience, whether or not that matches on to, you know, the core competencies within a clinical psychologist. So I think within my kind of AP role, I didn't do it in the UK. This was in Singapore. I had kind of varied experiences, clinically research, leadership, and supervision. And I think one of the things that I guess really wanted to highlight is supervision and how important that is. And I think that's not, you know, just to say, you know, having supervision with a clinician. I think it is about peer supervision as well. And when I talk about that, it's about, you know, communicating with colleagues. You know, it could be different professions as well. You know, I was working in a hospital, so I was very privileged that I was working within a team of, you know, occupational therapists, physiotherapists, speech and language therapists, and, you know, speaking to them about, you know, their perspectives on, you know, therapy for clients, you know, their therapy for clients was really helpful in getting kind of experience and understanding of, you know, how I could support as well within psychology field. So yeah, I think supervision in terms of, you know, learning from your peers, be it within psychology or interdisciplinary. And I think one helpful part about supervision is also the chance of reflecting. I think because I was 3 years in a role, I think sometimes when it gets busy, you're on autopilot. You don't really think a lot about what you're doing and, you know, what you're learning. And I think sometimes taking that pause to kind of reflect and think about, okay, you know, am I doing what I'm enjoying? What am I enjoying through this process is really important, because I think what the others have said as well, it is a long journey. So yeah, I think it's important to kind of enjoy that process as much as it can be stressful and challenging. And also I think through kind of supervision, a time to reflect, I think for me it was also really helpful, like what the others were saying, to identify, you know, your strengths and areas of improvement, and, you know, having to think about, okay, what other kind of experiences you need to get on to the doctorate. Yes, the experiences that I put on there is not, you know, kind of overnight I had everything, but it was kind of a build up of things as well. And, you know, as you get more confident and you try more things, you can get probably maybe opportunities to do other things as well. So yeah, I think that is a very helpful process for me. And I think particularly when you kind of apply onto the doctor, I think one of the key things that they do really value is what you learned from these experiences, and yeah, your kind of your reflections on your experiences so far. So, you know, thinking through that throughout all the different experiences you have, from the undergraduate, or, some people even prior to undergraduate, would be quite helpful, for the process. And I think, like what Alistar was saying, the context, your background, I think, I'm an international trainee. I was worried as well in terms of, not knowing the UK system, not knowing, the terminologies that people use, whether or not people understood what I was saying, culturally, whether or not I understood, just whether or not, people really understood what I was saying within therapy as well. So I think there are definitely a lot of anxieties and worries within the process. But what Alistar was saying, being yourself, I think definitely has its strengths. And I think it's also, I think being honest and authentic throughout the process is very important. So I think that kind of wraps up kind of all our kind of journeys and experiences. I don't know if anyone else had anything to add before we move on to kind of top tips. But I guess the top tips is really kind of echoing what we have really spoken about in terms of reflection being a key process, seeking opportunities, throughout the process is very important. I guess just adding on to that, similar to Alistar, after graduation, I was kind of applying to all sorts of jobs like RA, charities, AP roles. So really very varied, so seeking out opportunities would be very helpful, being open to that. And what the others were saying in terms of considering mentoring schemes, talking to people who are within the course. I definitely, I think before applying as well, I just DM some people on Twitter and LinkedIn to kind of ask them how the process is like. And I think many people are very, if time allows, they're very willing to kind of offer, support throughout that process. So I think not being afraid to ask and seek help as well. So that brings on the point of networking with psychological professionals, trainees, and lastly, to kind of check on the guidance before you apply, as some roles, for example, PWP training, which is a funded role, you will have to wait for 2 years post-qualification to apply for the doctorate as well. I'm not sure if anyone else has anything else to add at this point. Cool. So we will now transition to Q&A. So feel free to put your questions onto Slido, and we will, take it from here.
Thank you so much, Take. So as you can see in front of you is a QR code. Please do just scan the QR code and submit the questions, and we'll just be going through the list and identify the most kind of relevant questions to this webinar. I'm going to stop sharing here.
I think I just wanted to add that we will only be answering questions that are on Slido. So there might be people who have put their questions onto the chat. So just do that on Slido instead. Thank you.
So I'm also going to stop recording now.